Hi, my name is Shin, Master of Ki Energy Therapy. I have a special ability to withdraw spiritual energy called Ki from universe freely. I utilize this energy to reduce pain and improve condition of almost any kind of diseases, sickness, and injuries. I don't use any shots, needles, or medications. Therefore, my therapy is very, very safe. In fact, there is no side effects, yet it's remarkably effective. Today, I'm going to talk about blood pressure again. Previous two, I mentioned about blood pressure in relation to kidney diseases, but the importance of blood pressure much farther down the line. So again, I'm going to talk about it, and today is more of educational video, so we're going to talk about and learn how important blood pressure is all about. I've been taking care of so many people with incurable diseases, from older folks to young people. When I come across someone who's taking blood pressure medication because they have obvious reasons, however, sometimes I come across some young people, not obese or not having kidney problem, but they've been taking blood pressure medication for 5 years, 10 years. So every time I come across people taking blood pressure long time, I ask them a question, why you are taking it? Everybody answers the same way. That is, doctor told me I had high blood pressure, so they prescribe medications without having much of a doubt. It is okay if you can trust your doctors, it's okay, that's the best way to do that. But if you have any doubt, you really have to know how important, how bad the medication is all about. So today I'm going to present you 5 categories of blood pressure related topics. First one is the role of the blood pressure. Second one is what is your true blood pressure. Third one is what is the dangerous level of your blood pressure. Fourth one is who is controlling your blood pressure. Fifth one is how to improve and reduce blood pressure correctly. The role of blood pressure you have to understand, otherwise you are not sure whether or not it's necessary for your health to take blood pressure lowering medications. It's if you like, for example, if you try to give water to the lawn, if the lawn is right in front of you, you don't need much blood pressure at all. But if you try to give the water to the lawn in the far away, you have to increase blood pressure to make sure it reaches there. It is happening the same way inside of our body. If you try to send the blood just right next to your heart, you don't need much pressure. But if you try to reach to the top of your head or tip of your finger or bottom of your feet and come back to the heart, you have to have a certain amount of blood pressure. Otherwise, it's not going to reach there and come back. If it doesn't happen, certain section of the body, what happens to that section of your body? That section is going to die, become cancerous, or all sorts of problems. So you have to have a certain amount of blood pressure. However, if you have too high blood pressure all the time, that blood pressure damages your blood vessel. So it is dangerous. So you have to understand whether or not you have high dangerous blood pressure or you have normal blood pressure, but without knowing it, you just don't know whether or not you need blood pressure medication to lower it. If you are currently taking medications to lower your blood pressure, I just want you to remember what happened when you first time visit your doctor. If your doctor or nurse took your blood pressure once or twice and told you that you have high blood pressure, it may be totally wrong because that may be your regular blood pressure. The best way to find out whether or not you have a true blood pressure is this way. You have to take a blood pressure 3 times a day, 1 in the morning, 1 in the afternoon, 1 in the evening for 7 to 10 days and average it out. That's your true blood pressure. But if you are sick, blood pressure tends to be higher. So you have to measure it when you are healthy condition. Without knowing it, you just don't know whether or not you have dangerous level of high blood pressure. So that is very important. Unfortunately, 99.9% of people never pay attention to their own blood pressure, healthy blood pressure, until they get sick. And because they don't know what is in their true blood pressure, they just accept whatever doctor tells you to do. That is very, very dangerous. According to American Heart Association, if you have a blood pressure of 130 systolic pressure, you have a stage 1 high blood pressure. and doctors usually prescribe medications. But I want you to understand it. When you are in a doctor's office, most of the time your blood pressure is higher because something's wrong. In addition to that, our blood pressure reading fluctuates quite a bit, plus or minus 10 to 30 or 40 for sometimes. So just taking once or twice of blood pressure does not mean much at all. Besides that, each one is different. If you think your height is like 5 feet 5 inches and blood pressure of 120, if you're like 6 feet 10, blood pressure may be needed higher in order to bring the blood to the taller person to the head and bottom of the feet. It takes much more blood pressure to make sure reach the far in distance. And if you are heavy, if you are young, if you are old, each person has a different blood pressure. There is no such a thing as a one size fits all for everybody. I want you to understand it. And also, as we get older, our blood pressure tends to be higher. Do you know why? Because everything becomes tighter. Our blood vessel is not as flexible as when we are young. So when they try to push the blood to the blood vessel, blood pressure increases. And if you have some kind of disease, cholesterol inside of your blood, you tend to have a higher blood pressure. So lowering it by taking medication is not a good way to solve the problem, because problem is not blood pressure itself, but something else. So in order to solve the blood pressure problem, you have to solve the origin of the problem, why you have higher blood pressure. Japanese way is holistic way, not the Western medicine in Japan, but holistic way, Japanese way of understanding of blood pressure is this way. As long as you have 90 plus your age, you are okay. For example, if you're 50 years old, 90 plus 50 is 140. So systolic pressure of 140 regularly is acceptable level. But Western medicine methodology, 140 is too high. You have to have blood pressure medication to lowering it. Used to be that level was 150. They lowered to 145, 140, 135. Now it's 130. If you take blood pressure for everyone, every population, maybe more than 50, 60% of people are categorized under the high blood pressure area. Then everybody has to take medications of those people. That's ridiculous. If you take medications, you have to take a medication not for 1 week or 2 weeks, but continuously taking it as long as the measurement of your blood pressure is within 120 over 80 level. That is dangerous because you may need higher blood pressure to make sure blood goes to every part of your body. Blood pressure is controlled by autonomic nervous system, same as our heart, lung, and digestive system. So if everything's okay, blood pressure do not change much. But if something happens, blood pressure go up or down quite a bit. Same thing like a heart rate. If you are just sitting, your heart rate is maybe 65 or 70 per minute. But if you start walking, start doing exercise, heart rate go up, right? And your breathing system, the same thing. You have to breathe more air in to make sure your body's need is being met. Same thing happens with blood pressure. It fluctuates quite a bit. So it's normal to have sometimes higher blood pressure and sometimes lower blood pressure, but nobody die higher pressure. I have come across several people at the dying condition and their blood pressure going down like 80 over 50. That's the time they are going to die. So you have to know what is the blood pressure for yourself is good. So, but once medication coming in from outside, try to lower your blood pressure artificially, your brain cannot control your blood pressure for the need of your body. For example, some people who have a kidney disease or diabetes or edema, you have to have blood to reach this every segment of your kidneys or brain or legs. If it doesn't go there, that part going to become rotten and die and become cancerous. If your brain do not receive enough blood by lowered blood pressure medically, artificially, eventually down the line after you get certain age, you'll maybe develop Parkinson's disease or dementia. That happens to so many people right now. So that's how dangerous to control our blood pressure unnecessarily or artificially by taking medications constantly. Our brain have to control it, not doctors or medications. There are many ways to reduce your blood pressure temporarily. By breathing exercise or some kind of stretching, you can temporarily reduce your blood pressure. However, it doesn't last long because it's just temporary and it's not your blood pressure at all. Unfortunately, correct way of improving or reducing your blood pressure if you have a higher dangerous level of blood pressure is to correct the origin of the problem. If you have a kidney disease, your blood pressure is higher. If you have diabetes, could be higher. If you have obese, lack of exercise, cholesterol inside of the blood vessel, or hardening your blood vessel, those are the origin of the problem that you really have to rectify those origin of the problem. That's the cause of it. Otherwise, just taking medication itself to lowering it, you are actually inviting more problem. That's the way. So you have to correct the cause of the problem. High blood pressure, sometimes people have it, old age. As I said before, if you have 90 plus your age and if you're 50, 140 and you are functional and you do exercise regularly and you are not overweight, you don't have to worry about much. Taking medication is more risky than not taking medications. If you know you are out of fit, you are not doing exercise well, you are overweight, you have cholesterol so much inside of your blood, you know what you have to do. What you have to do is eat correctly or reduce weight, do exercise regularly. That's the only way you can get your blood pressure back to normal, healthy condition. Nothing else. There's no gimmick, no magic at all. So if you know you have a problem, you really have to rectify your problem, not the blood pressure only, because blood pressure goes to everywhere and we have to have optimum amount of blood pressure, and each person's optimal amount of blood pressure is quite different from one person to another. I want you to understand it. If you know you have a problem, you have to solve the problem. And blood pressure itself is not oftentimes the cause of your problem. Thank you.